All right, today we're going to dive into a topic that's, well, it's a classic for anyone studying biochemistry, and it's absolutely critical in the clinic. We're talking about maple syrup urine disease. So let's get right into it.
You know, the whole story really kicks off with this one very specific question, a clinical clue that takes us straight to the heart of biochemistry. Why on earth would a newborn baby's urine suddenly smell like burnt sugar or maple syrup? Well, the answer reveals a really dangerous metabolic crisis happening inside the body.
So, here's our game plan for today. First, we'll look at how the body is supposed to handle certain amino acids. Then, we'll get into what I like to call the metabolic traffic jam that happens in MSUD. After that, we'll talk about how doctors figure out what's wrong, and finally, how they manage the whole crisis.
Okay, so before we can really understand a traffic jam, we first need to see what the highway looks like when it's wide open, right? So let's explore the normal, smooth-flowing pathway for a specific group of amino acids.
So here's the official definition. Maple syrup urine disease, or MSUD for short, is an inherited autosomal recessive disorder. All that means is that a child has to get a faulty gene from both parents to have it. And its name, it comes directly from that key clinical sign, that sweet smell, which is caused by a buildup of byproducts from three specific amino acids, valine, leucine, and isoleucine. In a healthy person, this whole process is like a super efficient three-step metabolic highway. First up, the branch-chain amino acids. Let's just call them BCAAs. Get an amino group snipped off. That's called transamination, and it turns them into something called keto acids. Then, in this really crucial second step, those keto acids get broken down even more by a big enzyme complex. And finally, they're dehydrated. Basically, they have hydrogen atoms removed to create useful stuff for our body's major energy cycles. Simple enough, right?
Okay, let's zoom in on that critical second step. It's all run by the branched-chain alpha-keto acid dehydrogenase complex, or BCKD. Now, for this complex to do its job, it needs a toolkit of 5 essential cofactors. Now, listen up. For anyone studying for exams, this is a huge high-yield point. This toolkit is almost identical to the one used by the pyruvate dehydrogenase complex. Why does that matter? Well, they share cofactors like thiamine and work in similar ways. So if you understand one, you're well on your way to understanding the other.
All right, we've seen the open highway. Now let's see what happens when there's a massive, unexpected roadblock. We're talking about a metabolic traffic jam with some really devastating consequences.
And here it is. This is the core problem in MSUD. That crucial BCKD complex from step 2. It's either broken or it's just completely missing. This single faulty enzyme complex creates a total roadblock on our metabolic highway. Nothing gets past this point. So what happens in any traffic jam? A pileup. It's inevitable. Because the pathway is blocked, those BCAAs, valine, leucine, and isoleucine, and their intermediate keto acids, they have absolutely nowhere to go. So they start to build up to toxic levels in the blood, in the fluid around the brain, and, you guessed it, in the urine.
And this biochemical pileup, it has severe real-world consequences. And they usually show up just days after a baby's born. The accumulating metabolites are literally toxic to the developing brain, and that leads directly to the awful symptoms we see. The poor feeding, the lethargy, the seizures, these are all signs of brain dysfunction or encephalopathy, and of course, there's that distinctive sweet smell. This is a true medical emergency, no question about it.
And to get a little more specific about the damage these toxic keto acids do, well, it's pretty scary. They cause swelling in the brain, that's cerebral edema, and they actually strip away the protective coating, the myelin sheath, from neurons. This can lead to the death of brain tissue, causing permanent neurological damage if it isn't treated right away.
Now, it's important to realize that MSUD isn't just one single thing. It really exists on a spectrum. The classic, most severe form is where there's almost no enzyme activity at all. But then you have intermediate forms where there's still a little bit of function, and that leads to milder symptoms. And interestingly, there's a thiamine-responsive type, which is a great clue for treatment, right? Because remember, thiamine is one of the BCKD complex's essential cofactors.
Okay, so you have this critically ill baby showing all these signs. How do clinicians actually confirm what's going on? Let's look at exactly how they identify the location of this metabolic blockage.
So, diagnosis is a multi-step process. Lab tests are going to show sky-high levels of BCAAs in the blood and their keto acids in the urine. But the absolute game changer here is early detection. Most modern healthcare systems now include MSUD in their newborn screening panels. They use a technique called tandem mass spectrometry. It's this powerful tool that can find and measure specific molecules in just a tiny spot of blood, and it can catch the disease before symptoms even have a chance to start.
So, once that diagnosis is confirmed, it is all hands on deck. It's all about managing the crisis. The goal is to clear that metabolic traffic jam as fast and as safely as you possibly can.
The treatment plan has to be both aggressive and multifaceted. The absolute foundation is lifelong dietary management. This means using a special medical formula that has 0 of those 3 BCAAs. For those thiamine-responsive types we talked about, high doses of vitamin B1 can sometimes help boost whatever little enzyme activity is left. In a crisis, doctors might even use dialysis to literally filter these dangerous toxins right out of the blood. And for the most severe cases, a liver transplant can be a permanent cure by giving the patient a new, functioning source of the enzyme.
And this is probably the most important message of this entire explainer. Despite how incredibly severe this disease is, the outcome can be so positive. If MSUD is caught early through newborn screening and then managed meticulously from day one, these kids can avoid severe brain damage and go on to have pretty much normal development. It's an amazing success story for biochemistry.
So, let's do a super quick review. What's the cause? A busted BCKD complex. What piles up? Branch-chain amino acids and their keto acids. What are the hallmark signs? Sweet-smelling urine and neurological problems. And the treatment? Restrict those BCAAs in the diet and manage any acute crises. Got it? Good.
And hey, if you need a super simple way to lock this in for an exam, this mnemonic is perfect. Maple syrup means you've got branch trouble. And which amino acids are causing the trouble? Valine, leucine, and isoleucine are blocked. It's a really simple, effective way to remember that core concept.
So we'll end with this thought. The story of MSUD is just such a powerful example of how understanding biochemistry can take a fatal genetic disease and turn it into a manageable condition. It just shows you the incredible power of early detection and intervention. And it really makes you wonder, as our genetic and metabolic screen tools get even better, what other inherited disorders are we going to be able to manage this effectively in the future?